two things. That is the definition of school psychologist. We have understood the difference between school psychologist and the educational psychologist, right? So what's the difference between school psychologist and the clinical psychologist? Because the school psychologists, they are dealing with the learning disabilities. Clinical psychologists also, they are dealing with the learning disabilities. Then what's the difference between them?
Actually, the clinical psychologist can do an IQ test when they can give they have a register in RCI, but school psychologists as of now they don't have any license to give a report regarding IQ test and all. But learning disabilities they can issue, sir. That is, I think that is the difference between, and clinical psychology can work in a clinical setup, but school psychology will work under in schools to relate with all the head of the school, teachers, parents, as well as educators. But the clinical psychology will assist the student and give the report to the parents, not detailed related to school psychologist.
Okay, thank you, Kamini. Very nicely you have covered. School psychologists also follow the principles of clinical and counseling psychology, but their approach is the humanistic. Okay, they are following the humanistic and person-centered theoretical orientations. But clinical psychologists, they are following the psychoanalytic approach, behavioral approach, behavior therapy, and cognitive behavioral theoretical foundations. Okay. They are studying the cognitive distortions. They are studying the cognitive behavior therapy. That is their approach. Mainly, that is the patient and the therapist. But in case of the school psychology, there is no question of any patient. Okay? It's a client. Client has some problem. Student has some problem. So there will be no psychiatric nosology on the students. Maybe there is some anxiety related to the writing, anxiety related to the reading, anxiety related to the math. That does not mean the school psychologist will diagnose the student as any psychiatric nosology, psychiatric classification. For example, you can tell that is okay, this difficulty is due to the general anxiety disorder or GAD. The child has some behavior disorder like that. Okay, so that is the function of clinical psychologist. So that is their approach. Okay, so they can relate, that is, this type of anxiety is due to some psychoanalytic factors. So that is there. But school psychologists will not be concerned with that area. School psychologists will follow the humanistic approach. Is it clear or any question? Please you write. The scope for a school psychologist includes helping children with learning disabilities and behavioral problems. Next, evaluating children experiencing academic difficulties. Evaluating children experiencing academic difficulties. Developing academic or behavioral plans for children. Okay? Developing academic or behavioral plans for children. Now there are few principles of assessment. Please you write down. Assessment should be valid. Number one. Number two, assessment should be reliable. Number three, information about assessment should be explicit, comma, accessible and transparent.
Sir, information about assessment should be explicit,
accessible and transparent. Clear, comma, accurate, comma, consistent and timely information. Full stop. It should be made available to students, staffs, and other external assessors or examiners. That means whatever the assessment, that should be very much objective. Assessment should be reliable, it should be valid, and it should be objective. As
Student staffs and other.
Actually, whatever comes to my mind, I am telling. I do not know. Other external assessors or examiners. Principle 4. Assessment should be inclusive. And equitable. Full stop. Assessment findings should not disadvantage any group or individual. Principle 5. Assessment should be an integral part of program design. Principle 6. The amount of assessed work should be manageable. The amount of assessed work should be manageable. Principle 7. Formative and summative assessments should be included in each program. Principle 8. Timely feedback. To facilitate improvement in learning. Principle 9. Assessment of students must be competent to undertake their roles and responsibilities. So Kamini, please tell me, please repeat.
Assessment should be validity, reliability, information about assessment, perhaps accessible, transparent, and acquired, consistent and timely information. It should be available for students, educators, school and an examiner. Fourth one is assessment inclusive, equitability. Assessment findings should not be disadvantage any group or individual. Assessment should be integral part of the program design. The amount of assessors should be manageable. Formative and summative assessment should be included in each program. Timely feedback to facilitate to improve in learning. Assessment of students must be competitive to undertake the roles and responsibilities.
Very good. So to sum up, that is, assessment should follow three principles. Number one, educational principle. Number two, ethical principle. And number three, regulatory principle. Okay. What do you mean by the reliability? Assessment will be reliable. What's the difference between reliability and the validity? Joseph, can you tell?
Reliability is basically the trustworthy of the assessment or the test, and validity is how can we can go along with the assessments.
No, Kamini, can you tell? Debjani, Mona Lisa, Bapon, Putul.
The reliability is the
What is the difference between reliability and the validity?
Sir, reliability means that when we can rely or trust with something, and validity is a time period. For any test, it's a time period.
reliability, consistency is there.
Yes, in case of the reliability, consistency is there. It is not the trust only. Okay.
This
It is not the case of the
consistency.
trust only. It is the consistency.
Yes.
And what is validity? Validity refers to
That we want to measure.
what we want to measure. So in case of the validity, criterion is important. For example, you are saying that the child has some cognitive disorder, but the child performs well in the examination. That means your assessment is in question. Okay. So that is the problem of the validity. Is it clear now? So in case of the validity, one criteria should be there. But
Yes,
in case of the reliability, there is no question of any criteria. Any external criterion is
Yes,
not
sir.
required. So today's assessment, for example, you have find that is, you have noted that the boy has reading difficulty. And the reading difficulty score is maybe the 30. And after 1 month, again, you have collected the data and you have noted that is the reading difficulty score is 30 or 25, like that. But not the 50. That means there is consistency. It is called the taste, retest, reliability. And when you say that this individual or the boy has difficulty in calculation of math, in conceptualizing the mathematical concept, and the boy performs very poor in mathematics examination or in arithmetic examination, that means you are relating two things. One is your assessment score, another one is the criteria. So the criterion is not controlled by you. That is the academic achievement. Okay. That means your assessment is valid. So you have to follow this principle and you have to present your findings in such a manner so that the parents and the students they will not develop any confusion, any anxiety, or the self-esteem level is low. It should not be. Is it clear to all of you? Do you have any question?
Yes.
So Kamini, please you summarize today's lecture.
We have seen the difference between the school psychology and the social psychology.
Educational psychology
Sorry, educational psychology
and the clinical psychology.
and the clinical psychology.
Yes.
And we have seen the definition of each and what is the role of a school psychologist. And the Wineland social assessment can be, we have seen the Wineland social assessment regarding the formative, summative assessment and the principles of assessments. And what is the reliability and validity? And we have seen some, you have given some example today about the assessment, how the criteria will be, how the consistency will be. So we have lastly we seen that two examples.
Very good. Thank you, Kamini. Sebastian Joseph,
Yes.
is it clear to you?
Yeah.
Okay. Devjani, Bapon, any question? Okay, so I think it is clear to all of you. Kamini, in your case, specifically in assessment principle, you can add another thing. That is the educational principle, ethical principle, and the regulatory principle.
Yes, sir. Sorry, sir.
So these things are very important because you have to maintain the ethical principle. Otherwise, the students and the parents will be confused. So you have to maintain the.
Sure.
Yes, that is very important. Yes. Another thing that is you have to present the assessment report in such a manner that you can make some intervention. You can regulate. Okay. And you have to assess. the behavior in such a manner so that the educational achievement or academic achievement of the students can be enhanced. Okay.
Okay, sir.
So I'm requesting Mona Lisa, please you start the prayer.
So, please close your hands. Om Purnamada Idam Purnat Purnachate Purnascha Purnamadaya Vaibhavasisate Om Santi Santi Santi.
Thank you.
Thank you, everyone.
So tomorrow again we'll meet at 8 p.m. Okay.
Okay, sir. Thank you, sir.
Thank you,
Thank you.
sir.
Thank you.
Thank you, sir.
Thank you.
Please write your feedback.